What about traumatic, what if a child falls down? How do you know there's something wrong? Okay, and kids fall all the time. Okay, you can't take them to the doctor every single time they fall. You could, then you'd probably be called neurotic. Okay, but you need to know when there's a change in their behavior, okay, when they're sleepy, and they shouldn't be, when they're irritable and crying, and it's not a time to be irritable and crying, when they're vomiting, when they won't eat, when there's a significant change in their behavior, it's time immediately to call your doctor, if it's really serious, to call an ambulance, or to call a number here if you can't get in touch with somebody, and get some professional advice. Okay? If there's swelling, significant swelling, and sometimes the swelling can start hours later, okay, because it may be indicative of a fracture or a subgaleal bleed or something going on, it's important to let a physician know about it. Because whether it was totally accidental, okay, but if you present yourself 2 days later to an emergency room with a child whose head has got a huge swelling on it, you're going to be asked, why now? What happened? Giving the answer is, I have no idea what happened, is a problem for us. Because we can't, if there's a significant injury, if there's a fracture underneath there or something, and no one knows what happened, that implies lack of supervision, which is what I just talked about. Okay, it means no one was around watching the baby, and the baby got a significant injury. So you need to do some chakiras. You need to ask the 8-year-old who may have been watching, or the 11-year-old who's no longer in the house and he's somewhere else. Okay, but maybe he was holding the baby. Maybe it wasn't such a bad injury, but fractures can happen. Okay, from a 3 or 4 foot fall, the baby could have seemed okay afterwards. And a fracture isn't necessarily a bad thing. But you need to understand what happened and what the injury is. Okay? If these situations arise, just clamming up and saying nothing, and say, I don't know, that's it. You know, it's just there. That's a problem. Okay? And in these kind of situations, if you're in an emergency room, you're in an urgency center, and you feel like you can't deal with it, call for help. That's part of the reasons that we have this set up and this number, okay? We have experts, we have people to help you in these situations. If, God forbid, it's really abuse and something really happened, okay, you need to say so as well, okay? Because the help will come, and there may be inyanim that happen, but the truth usually, and almost 99.99% of the time, is the way to go, okay? Covering things up, different stories, all trigger investigations and problems. Okay, telling the emes is the olama emes. We should keep it to that. Okay, in the vast majority of the time. Okay, and in these situations that I'm discussing, get medical advice. Go to your pediatrician. You know him. The child's not that sick. Call him up. Go in. Get the baby checked. Okay. For older kids, you can see headaches and pain and fatigue and all kinds of things when they have traumatic brain injury. It could be they were playing baseball in the street. They may not even tell you. They may not even realize. They could have fallen down and bumped their head. Someone could even fall and have a seizure, hit their head, and not even know not even remember they had a seizure from a concussion. Okay, you see someone with these kind of questions, problems. You need to look into it, obviously, and it may have been caused by an injury. Okay, and concussion means that you had enough of an injury that it's changed the physiology in the brain to cause symptoms. Okay, headache, nausea, balance problems. If someone hit their head and lost consciousness, or has an alteration in their consciousness, it's not okay to wait 10 minutes and see if they're okay. They need to get checked out. Even if they're okay 15 minutes later. They, God forbid, could have an epidural bleed. An epidural bleed is something which could be, you could have some loss of consciousness, and you're okay, and you're fine, and then a half hour to 45 minutes later, you collapse because there's bleeding into your brain. Okay? So you need to seek attention quickly. Okay, so you need to know the signs and symptoms of these things, and you need to know when to call for help.